What I would say to a woman who is suffering with fibroids is that there are alternatives, and do what you can to explore those alternatives, particularly with Dr. Sudwarts and his team.
A lot of women feel trapped that they have to choose between living with the pain from the fibroids or going ahead with major surgery. And that's what we're trying to explain to patients, is that they don't need to make that decision, because we can offer them a treatment that's permanent and non-invasive that would sort out the pain that they're dealing with without having to go through major surgery.
The amazing thing about this procedure is that it is not an operation. We are literally going to do the entire procedure through a drip in your wrist.
The microsurgery does quite possibly the most fibroid embolizations in the world in a year as an individual practice.
And then once we're in those tiny arteries that are feeding the fibroids, we then inject these tiny particles. Those particles go in and then they block the blood supply to the fibroids. So now, because there's no blood getting to the fibroids, they actually shrink and they die, and they don't cause problems anymore.
I was advised that my next step would be a hysterectomy. And then I got a second opinion, and that's how I found out about the surgery with Dr. Sudwarts.
So this is an awareness initiative that we can just explain to patients that they have a choice. They don't have to do what people did in the past, and that there is a treatment option that is very well researched, fully funded, and works. That they are very safe in our hands, and we've got many, many patients who are happy with the results.
My intent is to help the journey of the medical aid authorization be smooth as possible for our patients. We assist with the authorization so that they don't have to deal with it.
After doing so many fibroid embolizations, we could then move on to fallopian tubes and cancer treatments and pain treatments. So there's a wide range of interventional radiology procedures that we perform.
For me, the most important for our patients is treatment, communication, and happiness at the end of their procedure.
I had a really good experience with Dr. Sudwarts and Christian Barnard, and they were fantastic.
After having performed so many procedures on so many patients, we've seen the long-lasting effects of the procedure, and that patients have told so many people that they know about it. I'm seeing sisters and daughters of patients coming through, so it's very rewarding.